You're experiencing recurring pain episodes from your sickle cell anemia, so your doctor sets you up on a date with Miss Emma. That's her street name. Her actual name, Morphine. Hello everybody, my name is Melissa Estadelia. I have a bachelor's in sciences and pharmaceutical sciences from UC Irvine, and I have 2 years experience as a pharmacy technician where I learn directly under a pharmacist and everyday patient interactions, which gives me both academic and professional experience in the understanding of opioids. I'm here to inform you about what morphine is, how it is used, how exactly it works, and some of its clinical applications. I hope that the dangerous allure of a hard street drug like morphine will draw you in, but the satisfaction of knowing more about pharmacology yourself will keep you around. So let's get to know Miss Emma a little better, who she is and what she does for a living. So in the 2023 newsmedical.net article, Morphine Pharmacology, written by clinical pharmacology specialist Dr. Ananya Mandal, she tells us that morphine is an opioid drug which is derived from opium found in the seed pods of poppy seeds, used to treat moderate to severe pain. But what exactly does it mean to treat pain? Well, you can treat pain at its source, or you can change your perception of the pain. So let's say you have a really bright light that's really bothering you. You can treat the source of it, turning off the light, or you can change your perception of the light, so covering your eyes. So in the undated morphine article on online pharmaceutical encyclopedia, drugs.com, reviewed by Sanjay Sinha MD, it's described how morphine treats pain by altering the perception of pain, and it does that by working on the brain and the nervous system. But the morphine's high potency on the brain and nervous system is exactly what makes it such a highly addictive and dangerous drug. So there are many harmful side effects of morphine. Some of them are outlined in this cute little mnemonic, but let me just go over 3 main categories. First of them is mental alteration. So that would be sedation, feelings of euphoria or extreme mood changes. Next one would be gastrointestinal effects. That would be nausea, vomiting, constipation. Last one, I think is the most important and the most dangerous, is respiratory depression, which is the R in morphine. Respiratory depression is lowering the breathing rate and lowering oxygen levels. This is very harmful to the body, given that oxygen is very essential. So when you lack oxygen, you can go into cardiac arrest, and the lack of oxygen in the brain will also lead to seizures. So this is where the addictive part of morphine, wanting its euphoria effects more, puts you at greater risk of overdose and death because of the respiratory depression side effect. So now that we have gone over who Miss Emma is and what she's used for, let's talk more about how Miss Emma works. So morphine relieves pain by binding to opioid receptors. Authors Dhaliwal and Gupta wrote in an undated National Center of Biotechnology Information article, or NCBI article, describing exactly what the action of receptors is. So as a quick biology refresher, a receptor is a protein that is on, or it can also be inside the cell, that receives a substance or ligand that causes a certain cellular response or activity. So that is a very complicated action. So let's just make it a little more simpler. Let's think about iPhones. When your iPhone receives a Wi-Fi signal, you can do a lot of things. You can browse the internet, look up Wikipedia articles on morphine. Very fun. However, you can't do multiple apps on an iPhone. You can only do one app at a time because it's not an Android. Only Android users can do that. So receptors have very specific functions. And also, you can only browse the internet with Wi-Fi. You can't do it with solar power or gasoline, for example. So the receptors only respond to a certain stimuli. So in Dr. Mandal's Morphine Pharmacology article, she outlines how there are 3 opioid receptor classes. So there is mu, kappa, and delta. In another NCBI article dated 2023, which is written by Murphy and co-authors, it stated that morphine's affinity for mu receptors is what gives most of morphine's analgesic or pain-relieving effects. So now that we have gotten to know Miss Emma a little better on who she is and how exactly she works, let's talk about her practical use. So proper use of morphine is decided by healthcare professionals who understand when the pros outweigh the cons. So in the NCBI article written by Murphy and coworkers, it's described different situations where morphine is medically necessary. Some examples would be end-of-life care like hospice, active cancer treatments, and sickle cell anemia. So pain situations where the pain levels are very hard to treat. However, the article also assures us that proper parameters are taken to ensure patient safety. So this would be precautions like monitoring the patient's blood pressure, checking their mental awareness, and checking their oxygen levels, of course, given its dangerous respiratory depression effect. You also want to look out for different drug-drug interactions. You want to avoid other drugs that also cause respiratory depression. And Dr. Mundell also warns us of tolerance to opioids. So as you take more of the opioid, you will get more immune to its pain-relieving effects, which is what you want, which makes it more dangerous because the more that you're taking to achieve the same effect, the higher the risk is for overdose. So it's hard being put in a situation where you have to rely on dangerous opioids like morphine. But as a pharmaceutical scientist, I like to stay optimistic knowing that it's in pursuit of a higher quality of life. So now that you know how morphine is used, how it works, and some of its clinical applications, I welcome you as a fellow pharmaceutical scientist. So I hope you guys have a good night and that you rest easy knowing that you are empowered by this new knowledge. Thank you.